to parents or family members who were able to donate, and I have talked to family members who were not able to donate after a death. And the people who got to donate are grateful for the opportunity, almost always. And the people who didn't get to, so many of them are so sad that they didn't get that opportunity. And so I really believe that one of the things I learned about after Andrew died was that California opened what is called a donor registry. And so I went to donatelifecalifornia.org, and our whole family signed up as potential donors. And by doing that, it means that when I die, and after I have been declared, gone through the whole death declaration process, a hospital can send my name to this registry, and they will then find out if this is what I wanted. So I don't have to have my driver's license. I don't have to have that pink dot. Somebody knows.
Right, and that's the registry for everybody in California.
Anyone in California. And as far as I know, all 50 states now have organ donor registries.
Oh, that's great.
So if I move to another state, I go to their state's registry and I sign up. And
one thing that's important, is that that registry is not checked until the patient has passed.
Until you're dead. You have to be dead.
They do not even let the physicians know that are working on the patient that somebody is in the registry. So they are giving the full care.
Like I said, great efforts have been made to make sure that everyone is comfortable that the person that they loved got the best care they could. And I think that is a real service that we do to the people who are left behind.
Absolutely. So let's talk about the recipients of the organs. Or actually, what organs were donated, to your knowledge?
Andrew, well, one of the wonderful things was we got a letter shortly afterward. After everybody had stabilized from their surgeries, we got a letter that told us that Andrew's liver went to a man who at the time was 49 years old, living in the Central Valley. And that's what we got to know. And that he had a family, and he had 3 children. And one of Andrew's kidneys went to a man who was in his, I think, 40s at the time, living in Northern California, had, I think, 5 children. And one of his kidneys went to a woman from Japan. In Japan, the attitude toward organ donation is very different from the attitude here, and people from Japan who are desperate and can afford it can come to the U.S. and occasionally get an organ. So one of Andrew's organs is in Japan. His small bowel, I had no idea we could donate. The intestine, the small intestine, went to a girl who was 7 years old at the time. And as far as we know, they are all alive still. His corneas have a longer out-of-body time between donor and recipient, and his corneas went each to 2 women on the East Coast who got to see for the first time in a long time.
Oh, how wonderful.
Other tissues have been donated, but they don't tend to keep us apprised of tissue donation because tissues can be donated for up to, I think it's 5 years. And tissues, skin, cartilage, bone, can be stored and spread out all over the place. And that can be a lot of people. One person can affect a lot of people's lives by doing this.
That's amazing.
And we were disappointed that his heart did not find a recipient. But it wasn't until we met one of his donors, one of his recipients, his liver recipient, that we found out that Andrew had B negative blood. And people with B negative blood make up about 2% of the population. We've only met one recipient. But it's been meeting Andrew's liver recipient has been almost as life-changing as losing Andrew.
Now you've not only met him, you actually have
He
are
and
in a
his-
relationship.
He and his
Are friends with
family
him.
are part of our family. We have spent the last 3 Thanksgivings together. We have vacationed together. We've gone camping together. He and his wife had been fostering a little girl who was born 8 months after Andrew. Her name is Andrea.
Amazing coincidence, huh?
And one of the things that we learned from the recipient's point of view is when an organ becomes available, many organs are not an optimal match. And they come in and they tell the recipient a little bit about the donor. In this case, they said that it looked like a really good match, that it was from a little boy who was 8 years old. No name, nothing. And they looked at Andrea, who was there in the room with Ken, and burst into tears because all they could imagine was losing their 8-year-old. Ken had been working in a hospital about 20 years before then and was stuck with a needle and contracted hepatitis C. And because he was B negative, he'd been on the recipient list for 7 years. That week, Ken's liver failed completely, and Ken was in the process of dying. He was medevaced to California Pacific Medical Center and was saying goodbye to his family. His family was all there. He had said goodbye to his friends, and it was basically a death watch. When all of a sudden nurses came in and started pulling blood and doing things, and then they came in and they said, "There's an opportunity." The doctors later told Ken's wife that he would have been dead within 72 hours.
Wow.
The next available liver, which was not an optimal liver for him, it was a type O, came available 17 days later.
2 weeks too late.
2 weeks too late. Ken and his wife and his family have been a wonderful gift. We gave and they have given. To know them has been wonderful.
He actually had written you something, and if it's okay, I'll read what he wrote. So he says, "I was daydreaming out loud with my wife recently and discovered another unexpected feeling. Even if I could miraculously be healed and my own liver could grow back, I wouldn't want to do it. Barring rejection, I'd like to keep the liver I have now. A little boy named Andrew Bedard died. His death gave me the chance to continue my life. I like him. His loss cost his mother, Carlina, and his father, Charlie, and his older brother, Adrian, so much. He was a cute, gentle, and good-natured boy, and he deserves to live. I like it that he is living in me."
It's, like I said, meeting Ken and Deborah was one of the best things that's come out of this. And they have become part of our family. Many donors and recipients do not meet up. Both donor family and recipient family have to agree to it before the network will arrange a meeting. We passed letters back and forth first, and we have to wait a year before we can meet. We didn't meet Ken and Deborah until almost 2 years after Andrew had died. But it has made such a change for us.
Yeah, it's wonderful that you managed to make turn what was and still is a tragedy into something valuable.
My attitude was I couldn't do anything about what happened to Andrew, but I could find good things from it. And working with the Transplant Donor Network and advocating for Donate Life California has given me something good to do.
Great. So is there anything in closing words that you'd like to have our audience know?
Two things. Organ donation benefits the people who receive, but it also benefits the people who give. The families who make this decision, every one of them that I have talked to has benefited from having made that decision. The other thing is, I'm very grateful to the people and the city of Saratoga. We got wonderful support from so many of the groups, the city council. So many people supported us. Andrews School and Saratoga Union School District. I am really very grateful. Like I said, I can't change what happened, but I can be grateful for what I had.
That's really, really beautiful sentiment. Okay, so this is Steve Reinheimer here with Carlina Odd. This is Health Talk, and thank you very much for joining us.